I want to thank you all for coming and joining me today so that we can talk about the legalization of marijuana for medical purposes. I started on the subject actually a little while ago researching it because it's actually something that's up for debate on legalization in our own state, and there's 13 other states that have already legalized and decriminalized marijuana for medicinal use. Before we can adequately be for the legalization of medical marijuana, we first must understand the history, use, its effects, and the benefits associated with its effects and alternatives to smoking it. What is medical marijuana used for? It has been used for paper, rope, canvas, clothing, recreational, and of course medical purposes. The history of marijuana, it's kind of a little printing there, but back in the 17th to 20th centuries, it was used to treat headaches, menstrual cramps, and toothaches. And in 2737, Emperor Shenneg of China was using it as a tea to treat gout, arthritis, poor memory, and malaria. In the 18th centuries, medical journals said it was used for pain, earaches, childbirth, skin inflammation, incontinence, and venereal diseases. And shortly after that, it arrived in the United States, and we were using it for arthritis and for nausea and vomiting from rabies, cholera, and tetanus. What are the effects of marijuana? Effects differ based on a person's size, metabolism, the potency of the marijuana, as well as the quantity and the quality of it. And this is true for any and all drugs. It doesn't matter if it was a marijuana or your blood pressure medication or your insulin or whatever. All of us are affected differently by medications and how they are absorbed in our body. Some of the benefits of for the use of marijuana is decreased nausea and vomiting, normalization of ocular pressure and glaucoma, which is the leading cause of blindness in the United States, as pain treatment. It has also been used for protection of nerve fibers and multiple sclerosis, which causes them to have tremors and severe pain. It's also been used and shown to stimulate brain growth in areas that are affected by anxiety and depression. And it has also been used and studied in prevention of plaque buildup in Alzheimer's disease. The best established medical uses thus far, though, are for anti-nausea, appetite stimulant, anticonvulsants, spinal injuries, multiple sclerosis, epilepsy, because of the seizures, pain, migraines, and arthritis, and other autoimmune disorders. Risks associated with medical marijuana use are impaired memory and impaired thinking, diminished balance and coordination, increased risk of heart attack, respiratory infections, cancers of the mouth, lung, and respiratory tracts, hallucinations, decreased immune response. So it just means it makes you more liable to get sick. Altered sense of time awareness, inability to complete tasks, inability to participate in conversations, paranoia, panic attacks, and increase in dopamine production. And the reason that is a problem is, like with steroids, when you take steroids, whether they're for your asthma or whatnot, your adrenal glands will eventually stop producing steroids, and so then when you take those away, you could cause a big problem. Well, the same thing happens with your dopamine. This increases the production, and so then when you take it away, the likelihood of you being able to produce it on your own is less likely. And though that is some people refer to it as your own personal morphine, it helps you with pain and also with just reward. It's that reward sensation, that feel-good sensation. Most common ways to use medical marijuana, of course, is smoking it. And there are alternatives to using it, which would be eating it, drinking it, and vaporizing it. Now, with the reason I talk about other alternatives to smoking it, because though the risk that I talked about of using it with lung cancers and mouth cancers and all of those, if you're not smoking it, you alleviate those issues. So really the better ways are to ingest them via vaporizing, which is just taking the plant and heating it to a low temperature of around 350 degrees and inhaling that vapor the same way you kind of would bake a cake in the oven. It's letting that vapor off that you would inhale, so then there's not the carcinogens and stuff that would build up in the lungs, increasing your chance of getting the cancers and stuff. And then of course eating and drinking it like a spice or a tea also eliminates the lung infections and stuff like that. So in conclusion, marijuana has been around for centuries. It's been used for all kinds of goods, including recreational and medical and religious purposes. There are definitely more studies that need to be done, and they're less harmful than tobacco and alcohol. And so we need to legalize and support those that need it, and those who live where it is legal and want to go other places to be able to use it. So thank you for listening.